What is PCOS? What do those cysts actually mean? And what does it mean if you have PCOS? And what can you do about it naturally? Hi, I'm Dr. Vala, and today in this video, we're going to cover what is PCOS, what do those cysts actually mean, and what does it mean if you have PCOS, and what can you do about it naturally? So let's start with what is PCOS? PCOS stands for polycystic ovarian syndrome. And this basically means that your ovaries aren't doing what we want them to do, which is ovulating regularly. And this can be due to metabolic factors like excess androgens. It can be due to insulin resistance, chronic illness, chronic stress. It could be due to insulin resistance. There are so many different factors that go into why you might have PCOS. But the main thing that we need to know about PCOS is that you are not ovulating regularly. That anovulation is a big factor in PCOS. And that anovulation is most often due to high testosterone levels. And when testosterone levels are high, we tend to see low estrogen levels. And this balance of high testosterone, low estrogen causes us to not ovulate regularly. And you may also see symptoms like hair loss and fatigue and low libido and dry skin. You may notice cystic acne or facial hair growth, body hair growth. And of course, irregular cycles where you have no idea when your next period is going to come. You have no idea if you're ovulating, and you have no idea if you're able to get pregnant or not this cycle. Any of these symptoms are a possibility with PCOS, but just because you have those symptoms doesn't necessarily mean you have PCOS. And just because you have PCOS doesn't mean you're necessarily going to have all of those symptoms. There's a lot that goes into the diagnosis of PCOS. But the driving factor here is insulin resistance. High levels of insulin are going to increase levels of testosterone, and high levels of testosterone are going to drop levels of estrogen. Like we talked about earlier, those are the two main factors that go along with the hormonal imbalances of PCOS that are leading to those symptoms. And high levels of insulin exacerbate the symptoms of PCOS. And insulin resistance is a key player in this condition. It means that your body is unable to effectively use insulin. And as a result, your pancreas is going to produce even more insulin, leading to a vicious cycle. So this excess insulin can contribute to weight gain, contribute to further worsening of that insulin resistance, and then more hormonal imbalances. So let's talk about what those cysts in PCOS actually are. A lot of people believe that having those cysts on your ovaries is a defining factor of PCOS. But that is a misconception. Having cysts on your ovaries does not necessarily mean that you have PCOS, because let's talk about what those cysts actually are. Those cysts that we see on an ultrasound are immature follicles. That basically means that they are follicles that are not fully maturing to be ovulated. And because of those hormonal imbalances that we see with low estrogen, because low estrogen is what causes that inability to ovulate, we need estrogen to peak to trigger FSH and LH to ovulate. With low estrogen, we're not seeing those follicles mature enough to be ovulated. So then we see a bunch of little fluid-filled sacs, which again are these immature follicles on an ultrasound that then look like a string of pearls, if you've heard that analogy. And unlike other types of ovarian cysts that can rupture and cause other complications, these are not harmful. These are just a symptom of those underlying hormonal issues. So what can you do if you have PCOS? Now that you have gotten all the testing done, you've been diagnosed, you know that this is what you have, and you're sitting there wondering, do I have to take birth control? Is metformin my only option? Do I have to be on spironolactone to manage my testosterone levels? Let me tell you, there are a lot of things that we can do naturopathically, diet-related, lifestyle-related, that you can do to help mitigate some of these symptoms of PCOS. Remember, going back to insulin resistance being a huge driving factor for PCOS, there's a lot that we can do to manage our insulin and blood sugar levels on a day-to-day basis. The first thing I want you to focus on are the nutritional changes to help balance your blood sugar and keep those insulin levels nice and low. The first thing you want to consider is how much protein am I getting in a meal? Because your protein is what helps you feel full, it's what helps slow down gastric emptying, and it's what helps you to not feel cravey for all those sugars and carbs throughout the day that are increasing your blood sugar, causing that spike, and then causing you to crash, feel tired, moody, irritable, and then again, just looking for another quick fix with carbs and sugar. So shoot for about 30 grams of protein per meal. And we also want to make sure that we are getting adequate fiber. This is not only going to help out your gut health, this is also going to help you feel full longer. So shoot for about 30 grams of fiber in a full day. And lastly, if you have insulin resistance, if you're really struggling with this, if you know you have really poor blood sugar regulation, then what we want to do is also limit our refined carbohydrate intake. So you want to limit carbs to about 75 grams per day. So that's going to be things like white rice or tortillas, bread, pasta, all of those simple carbs, refined carbohydrates. Things like legumes, things like vegetables, things like fruits are not going to count towards that 75 grams. The second thing that I want you to incorporate is going to be regular exercise. Do not be afraid of movement. I know in the PCOS world, there are a lot of people telling you to not do HIIT workouts, not do this workout. You should only walk. You should only do yoga. You should only do Pilates. You shouldn't do strength training. You shouldn't do strength training. And it gets overwhelming. What do I do? And then it makes you feel immobilized. You don't want to get up and do anything because you're afraid you're hurting your body more. I will say that the research has shown, especially for insulin resistance and PCOS, that exercise is the most effective thing that you can do. Because guess what? When we put on muscle, the more muscle mass we have, the more those muscles are going to soak up the glucose that we are eating, because it acts like a sponge, right? Our muscles are a sponge for glucose. We need that glucose for our muscles. The less muscle mass you have, the more it's getting stored. The more muscle mass you have, the more we're using it up to sustain those muscles. So strength training, resistance training, anything that you can do that you love doing that builds muscle. Here's how you know if your exercise is too much for you and that you need to slow down. If you are working out and feeling completely drained, completely exhausted, can't get off the couch, you can't do anything for yourself the next day, you are just tanked and drained, that is a sign that your body is not recovering for the activity levels that you're doing. And again, instead of cutting out exercise entirely, what we can do is focus on how can we support your body? How can we give you the recovery? How can we give you the nutrients that your body is looking for so that you don't feel drained, that you have energy, that you feel good after you work out? That is where I want to support you, not in, hey, let's get rid of exercise completely because you don't feel good. How can we support your body so that you can recover from the exercise that you're doing? So do not be afraid to exercise. There is tons of research to support that building muscle is a huge driver in improving insulin sensitivity and PCOS. And lastly, let's talk about supplements that I love using for PCOS. And I do want to preface, if you are working with a healthcare provider, I need you to check in with them before you add in any supplements, because I'm giving you the recommendations that I use with my patients that I see, but I don't know what you're currently taking. I don't know what your life looks like. I don't know what your health looks like. So please check in with your provider before adding in any supplements. The first one that I love using is Ovasitol. Ovasitol is a blend of two different inositols, D-chiro and myo-inositol, in a 1:40 blend. This is a huge one for insulin resistance that's taken over the PCOS world. So if you've seen PCOS on the internet at all, you've probably heard about Ovasitol. And I love using this because it not only helps with ovarian function to help with the health of your follicles to get them to ovulate, but it is also helpful for blood sugar regulation. It is also helpful for thyroid support. It's also helpful for stress and anxiety. We can use inositol for so many different things, which is why it is a great one for PCOS because of the amount of research that we have for what inositol can do for your blood sugar. Because long-term, berberine is also an antimicrobial and it may disrupt your gut flora. So make sure you are using this in conjunction with a healthcare provider that is managing how you are doing it, the dosing, and the long-term use of it. So if you suspect that you have PCOS, please make sure to check in with your doctor to get the appropriate lab testing, to get the appropriate imaging, to get the appropriate intake, to make sure that you are getting supported in the ways that your body is needing. Because if you feel lost, if you feel confused, we need to support you. We need you to be educated on what is going on in your body. So please check in with your doctor. And if you need some more support with your PCOS, please schedule a discovery call because I would be happy to create a plan for you that works for your body. If you found this information helpful, please like, share, and subscribe for more women's health information.